Hello, so today we're going to be talking about renal failure in Aboriginal and Torres Strait Islanders. I would like to start with acknowledgement of the country. We acknowledge the traditional owners of the land on which we are meeting today, the Wurundjeri Woi peoples of the Kulin Nation. We pay respect to their elders, past, present, and emerging, and extend respect to all Aboriginal and Torres Strait Islander peoples. Trigger warning, please be aware that this video may contain names and pictures of the deceased First Nation peoples. It might contain information about Indigenous peoples that could be distressing to the viewers. Talking about renal failure, in our body, the kidneys help in cleaning the blood by filtering out the waste material in the form of urine. Renal failure or kidney failure occurs when the kidneys are unable to do so as and function normally, and this leads to a buildup of buildup of waste fluids in our body, which causes a drastic impact on our health. It can be of two types, which is acute kidney failure occurs when there is a sudden and temporary loss of kidney function. The known reasons for this can be injury, infection, or severe dehydration. And the complex one, that is a chronic kidney failure or CKD, it is a progressive and irreversible loss of kidney function over the period of 3 months or more. The known reasons for this can be long-term conditions like diabetes and high blood pressure. The treatment for CKD includes hemodialysis and kidney transplant as shown in the pictures in the slide. Talking about Indigenous Indigenous Australians are 4 times as likely to die from chronic kidney disease as a cause of death than non-Indigenous Australians. The rate of kidney failure replacement therapy among First Nation Australians is 6 times higher than the non-Indigenous Australians, that is 63 versus 10 per 100,000 population from 2012 to 2021. This information is also reflected on the graph here, which shows the replacement therapy rates among First Nation Australian, where blue line reflects the First Nation and yellow the non-Indigenous. Now, the graph here reflects the percentage of new patients commencing on hemodialysis in Australia, where we can see that the First Nation people have a higher percentage as compared to the non-Indigenous, reflected by the blue line in this graph.
Renal failure is one of the most pressing and preventable health crises impacting Indigenous Australians. It's a condition that develops quietly over time, but its consequences are severe and often fatal. Indigenous Australians are up to 7 times more likely to develop end-stage kidney disease than non-Indigenous Australians. But this isn't simply a biological vulnerability, it's the result of a complex web of social, behavioural and cultural factors we urgently need to address. One of the key issues is low health literacy. Many Indigenous individuals receive little to no cultural appropriate education about kidney health, diet, and chronic disease management, without a clear understanding of what causes renal disease or how to prevent it. Early symptoms are often ignored until the condition becomes critical. In addition, social stigma around the illness, especially in smaller communities, can prevent people from seeking help early. There can be a fear of judgment, shame, or even a sense of fatalism, where people believe disease is inevitable and therefore not worth fighting. This kind of stigma is deeply damaging as it encourages silence, delays diagnosis, and contributes to higher mortality rates. Poor health choices also play a role. High rates of smoking, alcohol use, and poor diet are often coping mechanisms for deeper issues like intergenerational trauma, social exclusion, and mental health challenges. Rather than blaming behavior, we need to understand these choices in their broader social context and respond with empathy and culturally sensitive health education. Because when we are targeting kidney disease, we are not just treating an organ, we are intervening on a broader cycle of chronic illness, poor mental health, and systematic disadvantage. Renal failure leads to type 2 diabetes, hypertension, cardiovascular disease, and more, all of which can be managed better with the right knowledge and support. We need to empower Indigenous communities with knowledge, resource, and respect. This includes supporting community-led education programs, embedding culturally safe practices in healthcare, and reducing stigma around chronic illness.
Why does cultural safety matter? In Aboriginal and Torres Strait Islander communities, renal failure cannot be discussed solely from a medical perspective. We must also examine the way in which care is provided and whether or not patients genuinely feel secure in that care. the concept of cultural safety enters the picture at this point. Care that is culturally safe involves more than just simply checking boxes. It entails establishing an environment where Aboriginal and Torres Strait Islander people are truly valued, heard, and free to be who they are, where they are not stigmatized, criticized, or made to feel uncomfortable in a medical environment. However, in practice, that's not always the case. Many people experience a sense of insecurity in hospitals, particularly when they are separated from their homes, surrounded by others who are unfamiliar with their culture, or when no one even inquires about their priorities. For instance, many dialysis patients may travel for months at a time from their homes in order to receive treatment. They would be cut off from their country, their family, and the things that keep them rooted. It has a significant impact on whether patients continue their treatment. So, what does help? Community-led care that is managed by and for Aboriginal people. Relationships, trust, and a thorough awareness of culture are the foundation of organisations such as ATROS. In addition to treating physical illness, they provide holistic therapy that takes into account community, faith, and family. Having Aboriginal liaison officers, utilising visual or language-based health resources, and providing space for yarning rather than just clinical Q&As are additional factors that significantly impact outcomes. These methods foster trust, and people are more inclined to seek care when they feel valued. In the end, cultural safety isn't something optional, it's fundamental. If we want to support Aboriginal and Torres Strait Islander people living with kidney illness, we need to give care that's not only medically effective, but also emotionally safe, culturally durable, and community led.
We're now going to go into an example of what we've previously been talking about in order to treat renal care. So Purple House is one such excellent example. It was founded in 2003 in response to a crisis facing Indigenous peoples from the Western Desert. Until then, many had to leave their homes and travel vast different distances to Darwin or Perth just to access dialysis. This caused significant disconnection from family, culture, and country. What began with a single dialysis machine in Alice Springs has grown into a network of 20 remote dialysis clinics across the NT, WA, and South Australia. Dialysis typically requires 3 5-hour sessions per week, indefinitely. But most Indigenous patients live remotely, 4 times more likely than the general population within these areas. Leaving home for treatment causes serious social and cultural consequences, removing elders from their communities and weakening intergenerational ties. Purple House responds directly to this by providing dialysis on-country, using both remote clinics and mobile dialysis trucks. In 2024 alone, they delivered 10,373 on-country treatments, a testament to their effectiveness in care grounded on-country. So Purple House is an Aboriginal-controlled organisation, guided by a board of 12 directors from the Pintupi Lurija communities. Their governance ensures decisions reflect community values and needs. 1/3 of their staff are Indigenous, meaning care is provided by people who understand the language, culture, and lived experience of their patients, with a predominant number of these Indigenous staff coming from the areas that they serve. And non-Indigenous workers are provided with programs to encourage worker retention and stay in community, enabling community connection and understanding over time. To the left of this slide, we can see 3 of the Indigenous directors. So Purple House designs its services from the ground up. It centres Indigenous definitions of health and well-being in order to facilitate best culturally safe care. Programs encourage non-Indigenous staff to listen actively, reflect on their own biases, and centre the needs of the community. Indigenous people have reported they are 100% more likely to use Purple House over a mainstream service. In short, it shifts culture, country, and Indigenous community from a hindrance to compliance in care to one that is essential to provide best practice. So we can truly see, due to these factors, that Purple House is a success story. Since Purple House began, dialysis outcomes in Central Australia have gone from the worst in the country to the best. It's a clear demonstration that self-determined, culturally safe, community-owned care is not just respectful, it's effective. Thank you very much for listening today.